What are the key behavioral signs that an animal might be experiencing stress or pain, and how should an animal care provider respond to these signs? Answer: animals exhibit various signs of stress or pain that animal care providers should be able to recognize in order to offer appropriate care. Stress signals in animals include body posture changes. Tense or defensive posture, such as crouching or hiding, may indicate stress. Vocalizations: unusual vocalizations such as whimpering, growling, or whining may signal discomfort or distress. Behavioral changes, increased aggression, withdrawal, or excessive grooming can be indicators. Physiological changes, rapid breathing, dilated pupils, or changes in heart rate can also suggest stress or pain. In response, an animal care provider should ensure the environment is calm, reduce any stresses, and consult a veterinarian if the symptoms indicate pain or serious distress. Relevant guidelines laws. The Animal Welfare Act and guidelines provided by the American Veterinary Medical Association (AVMA) emphasize the importance of understanding animal behavior to assess welfare and provide timely care. Mr. Brown is an animal care provider at a shelter. One morning, he notices that the dog is behaving aggressively towards the staff and showing signs of restlessness, such as pacing and excessive barking. What steps should Mr. Brown take to address the situation, and what could be the possible reasons for the dog's behavior? Answer: Art Brown should first ensure that the safety of both the dog and staff members is maintained. In situations like this, Mr. Brown should assess the environment, determine if there are any stresses such as loud noises, unfamiliar animals, or sudden changes that could have triggered the aggression. Allow the dog space. Give the dog some time and space to calm down. Avoid direct confrontation, as this could escalate the aggression. Consult a veterinarian. If the behavior persists, it could be due to physical pain or discomfort. A vet should check for medical issues such as injury, illness, or infection that may be causing pain. Behavioral assessment. Mr. Brown should observe the dog's body language for signs of fear, anxiety, or frustration, which could also contribute to the aggressive behavior. Possible reasons: pain or injury. Aggression can often be a defensive response to pain. Fear or anxiety. The dog may feel threatened or stressed in its environment. Lack of socialization, inadequate exposure to people or other animals can lead to aggression. Explain the significance of enrichment activities in animal care and how can they contribute to the well-being of animals in a shelter or clinic environment. Answer: enrichment activities are crucial for improving the physical and mental well-being of animals, particularly in confined settings such as shelters or clinics. These activities reduce stress. Animals in stressful environments benefit from stimulation that diverts attention from anxiety-provoking stimuli such as new environments or confinement. Enhance mental stimulation. Activities like puzzle feeders, scent trails, and toys stimulate the animal's mind, preventing boredom and destructive behavior. Encourage natural behaviors. Enrichment can involve activities that mimic natural behaviors such as hunting, foraging, and exploring, which are vital for animals' emotional health. Promote socialization. Interaction with caregivers or other animals during enrichment activities fosters positive relationships and improves the animal's ability to cope with new situations. In a shelter or clinic setting, caregivers should tailor enrichment activities to each animal's species, breed, and behavioral needs. For example, dogs may benefit from puzzle toys or training sessions, while cats might enjoy climbing structures or interactive play. What are the basic techniques for performing CPR on a dog, and how do these techniques differ from human CPR? Answer: CPR, cardiopulmonary resuscitation, for dogs follows a general process similar to human CPR, but with adaptations for the dog's size and anatomy. The steps include: check for signs of life, ensure the dog is unconscious and not breathing. If the dog is not breathing, proceed with CPR. Chest compressions. Place one hand over the dog's chest. For small dogs, use one hand, and for large dogs, use both hands and compress at a rate of 100-120 compressions per minute. For small dogs, use one hand to compress the chest. For large dogs, use both hands to compress the chest. Ensure compressions are about 1/3 to 1/2 the depth of the chest. Rescue breaths. After every 30 compressions, give the dog 2 rescue breaths. Close the dog's mouth and breathe through the nose or mouth, depending on the dog's size. Differences from human CPR. Positioning. Dogs require chest compressions either at the level of the heart for small dogs or slightly lower on the rib cage for larger dogs. Rescue breaths. The method for delivering breaths differs as the dog's airway is different in shape and size. Mr. Johnson is a veterinary technician working at an animal clinic. One day, a client brings in a dog that has ingested chocolate. What should Mr. Johnson do in this situation, and what are the toxic effects of chocolate on animals? Answer: Mr. Johnson should take immediate action upon learning that the dog has ingested chocolate. The steps include: determine the amount of chocolate ingested, Chocolate toxicity depends on the type of chocolate. Dark chocolate is more toxic than milk chocolate and the amount ingested. Contact a veterinarian. The veterinarian will determine if the dog requires treatment, such as inducing vomiting, administering activated charcoal, or providing intravenous fluids. Monitor for symptoms. Common symptoms of chocolate poisoning in dogs include vomiting, diarrhea, increased heart rate, restlessness, and seizures. Toxic effects of chocolate. The toxic component of chocolate is theobromine, a stimulant that can affect the dog's heart, central nervous system, and kidneys. Dark chocolate has the highest concentration of theobromine and is the most dangerous for dogs. In severe cases, chocolate ingestion can lead to death if not treated promptly. In what circumstances should an animal care provider attempt to transport an injured animal, and what precautions should be taken during transport? Answer: an animal care provider should attempt to transport an injured animal when the injury is severe and requires immediate veterinary care, the animal is in a life-threatening condition, or exhibiting symptoms that may worsen without timely treatment, e.g. heavy bleeding or broken bones. Precautions during transport: stabilization. Secure the animal in a safe position, minimizing movement to avoid aggravating the injury. Immobilization. For fractures or injuries to limbs, immobilize the injured area with a splint or by securing it in a stretcher. Calm environment. Keep the animal as calm as possible to reduce stress, as agitation could worsen the condition. Monitor vital signs. Observe the animal's breathing, heart rate, and consciousness level during transport. Describe the different types of animal enrichment that are appropriate for exotic species and the rationale for using each type. Answer: exotic animals, such as reptiles, birds, and small mammals, require specific types of enrichment to ensure their mental and physical well-being. Examples of enrichment include, for reptiles, providing climbing structures or hiding spaces replicates natural behaviors like exploration and thermoregulation. For birds, offering toys that allow for foraging, such as hidden treats in puzzle feeders, encourages natural foraging behaviors and mental stimulation. For small mammals, providing tunnels, wheels, or textured materials helps mimic the exploration and burrowing activities typical of these species in the wild. Each form of enrichment serves to alleviate boredom, reduce stress, and promote natural behaviors, which are essential for the animal's overall health and welfare. Relevant guidelines laws. The Animal Welfare Act sets standards for the care of exotic animals, including the provision of enrichment activities that promote physical and mental well-being. How does behavioral modification work in animals, and what are some common techniques used to address undesirable behaviors? Answer: behavioral modification aims to change or eliminate undesirable behaviors in animals through consistent, structured approaches. The most common techniques include positive reinforcement, rewarding the animal for desired behaviors with treats or praise, reinforcing those behaviors over time. Negative reinforcement, removing an unpleasant stimulus when the desired behavior occurs, e.g., stopping a loud noise when the animal behaves appropriately. Desensitization, gradually exposing the animal to a feared stimulus at a low intensity, then slowly increasing it to reduce anxiety or aggression. Redirecting behavior, diverting the animal's attention to an appropriate activity when undesirable behavior occurs. Behavioral modification requires patience and consistency, as changes in behavior often take time to achieve. Relevant guidelines laws. The AVMA supports the use of humane behavioral modification methods that do not cause harm or distress to animals. The Animal Welfare Act ensures that animals are not subjected to cruel or harmful training methods. Mr. Anderson is an animal care provider working with a cat that has developed a respiratory infection. What are the common signs of respiratory illness in cats, and how should Mr. Anderson proceed with treatment? Answer: common signs of respiratory illness in cats include coughing or sneezing, nasal discharge or congestion, labored breathing or open mouth breathing, loss of appetite, or lethargy. Mr. Anderson should isolate the cat to prevent the potential spread of infectious diseases to other animals. Administer prescribed medication, e.g., antibiotics or antiviral medications as directed by a veterinarian. Provide supportive care, such as humidified air to ease breathing, hydration, and maintaining a clean and comfortable environment. If symptoms persist or worsen, Mr. Anderson should seek further veterinary intervention. Relevant guidelines laws. The AVMA guidelines on feline respiratory infections outline the proper diagnosis and treatment. The Animal Welfare Act ensures that the cat receives appropriate care and treatment to prevent suffering. Explain how species-specific behaviors influence the care and management of animals in a shelter. Answer: species-specific behaviors refer to the natural, instinctive actions and responses that vary significantly across species. Understanding these behaviors is critical in shelters for ensuring appropriate care. For example, dogs. Dogs are pack animals and benefit from socialization and structured routines to prevent anxiety or aggression. Cats. Cats are more solitary by nature and may prefer their own space and vertical surfaces for climbing. Birds. Birds require social interaction and mental stimulation such as puzzle toys or foraging activities to prevent boredom and feather plucking. Shelters must provide environments that cater to these species-specific needs to promote psychological and physical well-being and prevent behavioral issues or distress. Relevant guidelines laws. The Animal Welfare Act requires that shelters provide adequate care and enrichment tailored to each species' specific needs. The AVMA provides resources for understanding the behavioral needs of different species. What is the significance of permits in wildlife rehabilitation, and how should an animal care provider handle an injured migratory bird without the required permit? Answer: permits are crucial in wildlife rehabilitation because they ensure that animal care is conducted legally and ethically, protecting both the animals and the rehabilitators. Laws like the Migratory Bird Treaty Act, MBTA, and Endangered Species Act, ESSA, regulate the handling of protected species. An animal care provider must not handle migratory birds or other protected species without the proper permit, as doing so may result in legal repercussions, including fines or jail time. If an injured migratory bird is encountered without a permit, the provider should not attempt to treat or transport the animal. Instead, they should immediately contact a licensed wildlife rehabilitator or local wildlife agency. This ensures that the bird receives the proper care while remaining compliant with regulations. In the case of non-protected species, though, an animal care provider can proceed with emergency care but should aim to acquire permits or referrals for longer-term rehabilitation. Compliance with these regulations helps maintain biodiversity and supports the conservation efforts outlined by federal and state wildlife authorities. Why is it critical to balance calcium and phosphorus in the diet of reptiles, and what are the potential consequences of imbalance? Answer: reptiles require balanced calcium to phosphorus ratio, typically 2:1, for healthy bone growth and metabolic functioning. Calcium is vital for maintaining strong bones, muscle function, and nerve transmission, while phosphorus is involved in energy metabolism and bone formation. When the ratio is out of balance, particularly with excessive phosphorus and insufficient calcium, it can lead to metabolic bone disease, MB, a condition that weakens bones, impairs movement, and may even lead to organ failure. An imbalanced diet can be caused by feeding phosphorus-rich foods, such as spinach or broccoli, without supplementing with adequate calcium. Signs of MBD include deformities, difficulty moving, or soft bones that may fracture easily. Calcium supplementation, either through powders or calcium-rich foods like collard greens, is essential for ensuring proper health. Additionally, reptiles need UVB light to synthesize vitamin D, which is critical for calcium absorption. Without sufficient UVB exposure, even a balanced diet can fail to prevent calcium deficiencies. Therefore, reptile care requires a careful dietary approach, regularly monitored and adjusted to prevent such health issues. Proper diet and UVB exposure can help mitigate these risks and ensure long-term reptile health. What ethical principles should guide an animal care provider in resolving a conflict where a coyote is preying on domestic pets in a suburban neighborhood? Answer: ethical principles in human-wildlife conflict resolution emphasize humane, non-lethal strategies that prioritize both the safety of people and animals. The provider should adhere to these principles. Non-lethal methods first. Ethical care involves minimizing harm to wildlife. In this case, lethal control should be a last resort. The provider should promote methods like using motion-activated lights, fencing, or auditory deterrents to discourage coyotes. Community education, educating residents about securing pet food, trash, and using wildlife proofing techniques can prevent the coyote's attraction to suburban areas. This step aligns with responsible stewardship of both human and animal interests, promoting coexistence. Coyotes are crucial for controlling rodent populations, so understanding their ecological role is vital. Educating the community about the benefits of coyotes can reduce fear and build acceptance for non-lethal solutions. A collaborative efforts. The provider should work with local authorities, wildlife agencies, and conservation organizations to address the issue comprehensively. Such collaboration ensures that solutions are sustainable and legally compliant. Explain the importance of triage in wildlife rehabilitation and how prioritization is determined during a mass casualty event, e.g., an oil spill affecting seabirds. Answer: triage and wildlife rehabilitation is essential to manage resources effectively and maximize the survival of the most critical patients during a mass casualty event. In a scenario like an oil spill, the sheer volume of affected animals requires prioritization based on injury severity, the likelihood of recovery, and available resources. 1. Immediate care for critical animals. Animals with severe injuries, e.g., internal damage, major trauma, are prioritized for humane euthanasia to prevent suffering. 2. High survival potential cases. The animals that are mildly affected by oiling but otherwise healthy, e.g., a bird with light oil exposure but no fractures, are stabilized and treated first. 3. Mild or non-critical cases. These animals receive care after the more urgent cases. If resources are limited, less severe cases may need to be treated at a later time or in off-site facilities. During such events, the International Bird Rescue Research Centre provides protocols to guide triage decisions. The goal is to allocate resources to those with the highest chances of survival while adhering to ethical guidelines. Sarah, a licensed animal care provider, is tasked with transporting a stressed African grey parrot to a veterinary clinic. The bird shows signs of defensive aggression. What steps should Sarah take to ensure her safety and the parrot's well-being during the restraint and transport process? Answer: Sarah should take several careful steps. Calm environment. To minimize the bird's stress, Sarah should avoid loud noises, fast movements, and sudden changes in the environment. Restraint with a towel. Sarah should use a soft towel to gently cover and restrain the parrot, ensuring it doesn't panic or bite. The towel should be used to cover the bird's head to calm it without restricting breathing. Proper transport cage. Sarah should place the parrot in a secure, well-ventilated transport cage, ensuring it can't harm itself or escape. The cage should be covered with a breathable cloth to reduce visual stimuli. Monitoring. Throughout the transport, Sarah should monitor the parrot's physical and emotional state. Signs of increased stress, e.g., panting, fluffed feathers, should be addressed immediately by taking breaks. In all steps, Sarah must balance the bird's safety and comfort with her own, following the Animal Welfare Act, which mandates minimal stress during transport. How can public education initiatives reduce illegal pet trade in exotic species? Answer: public education initiatives play a critical role in reducing illegal pet trade by increasing awareness about its harmful effects on wildlife and ecosystems. These initiatives typically employ the following methods: raising awareness. By educating the public on the ecological damage caused by the illegal trade, such as species extinction and habitat destruction, campaigns can dissuade people from purchasing exotic pets. Social media and digital campaigns. These platforms can spread awareness about the legal and ethical implications of owning exotic pets, highlighting the risks to both animals and their owners discourages impulsive purchases. Supporting legal channels. Educating potential pet owners about legal and ethical alternatives, such as adopting from certified breeders or rescuing animals, promotes responsible pet ownership. Collaborations with law enforcement. Partnerships between wildlife conservation groups and law enforcement can help identify illegal trade networks and prevent trafficking. Campaigns often reference the Convention on International Trade in Endangered Species (CITES), which sets guidelines to prevent overexploitation of animals. What are the key indicators of illness in a rabbit, and why is early detection critical? Answer: rabbits are prey animals, meaning they instinctively hide signs of illness until they are severe. Early detection is crucial for successful treatment. Key indicators of illness include reduced appetite or eating behavior. Rabbits that stop eating or reduce their food intake may have gastrointestinal stasis, a condition that slows down digestion. Changes in fecal output. Small or infrequent droppings or diarrhea indicate digestive problems. Lethargy or behavioral changes. A rabbit that is less active or more irritable may be unwell. Nasal discharge or sneezing. These can be symptoms of respiratory infections like Pasteurella. Given the potential severity of conditions like GI stasis, early veterinary intervention is essential. According to the House Rabbit Society, rabbits should be checked regularly for subtle signs of illness, and any behavioral changes should be promptly addressed. What criteria must be met before releasing rehabilitated wildlife back into the wild? Answer: before releasing rehabilitated wildlife, the following criteria must be met. Physical health. The animal should be free from injuries that impair its ability to survive in the wild, such as broken limbs or infections. Behavioral fitness. The animal must exhibit survival behaviors such as foraging, hunting, or avoiding predators. Seasonal timing. Release should occur during appropriate seasons to ensure the animal can find food and shelter. Habitat suitability. The release area should have sufficient resources and conditions for the animal to thrive. Legal compliance. Releases must follow local and federal regulations. For instance, some species may require special permits to be reintroduced into certain habitats. The Wildlife Rehabilitation Act provides guidelines to ensure that released animals have the best chances of survival in the wild. How does the environmental enrichment for a sugar glider differ from that of a rabbit, and why is it necessary? Answer: environmental enrichment is vital to prevent stress and behavioral issues in both sugar gliders and rabbits, but the needs for each species differ. Sugar gliders, these nocturnal animals, need vertical space to climb, glide, and explore. They require enrichment items like branches, ropes, and nesting boxes to mimic their natural tree-dwelling behaviors. Sugar gliders also need opportunities for social interaction and mental stimulation through foraging toys. Rabbits, as ground-dwelling creatures, rabbits need plenty of space to hop and dig. Providing a large enclosure with tunnels, cardboard boxes, and chew toys is essential. Rabbits also benefit from access to safe outdoor areas to graze and explore. Enrichment is necessary to prevent boredom, which can lead to destructive behavior, and to promote physical and mental well-being. Explain the importance of maintaining a clean environment for both captive and rehabilitated animals, and the potential risks of poor hygiene. Answer: a clean environment is critical for the health of captive and rehabilitated animals. Regular cleaning helps prevent the spread of infections, parasites, and diseases, which can be particularly harmful in high-density facilities or during rehabilitation. Poor hygiene can lead to infections. Bacterial or fungal infections can thrive in dirty conditions, affecting the animal's respiratory or digestive systems. Parasites. Accumulation of waste and old bedding can attract fleas, ticks, or mites. Stress. A dirty environment can cause stress and behavioral problems, impairing the animal's ability to recover or adjust to captivity. Regular cleaning and disinfection of cages, food containers, and bedding are essential. Additionally, providing fresh water and food daily prevents contamination. Proper hygiene practices reduce the likelihood of disease transmission and enhance animal welfare during rehabilitation or captivity. Describe 3 behavioral and 3 physiological signs that may indicate anxiety or depression in animals. How should a care provider differentiate between situational and chronic anxiety in animals? Answer: behavioral signs: excessive vocalization, whining, barking, or howling without apparent stimuli; avoidance behaviors, hiding, retreating, or avoiding interaction with humans or other animals; destructive tendencies, chewing furniture, scratching excessively, or uncharacteristic aggression; physiological signs: changes in appetite, loss of appetite or overeating; altered sleep patterns, excessive sleeping or insomnia-like restlessness; physical symptoms: trembling, excessive drooling, or gastrointestinal distress like vomiting or diarrhea. Differentiating situational versus chronic anxiety. Situational anxiety, often tied to specific triggers such as loud noises or separation, and resolves when the trigger is removed. Chronic anxiety, persistent over time regardless of immediate triggers, and often requires long-term management strategies like behavioral therapy or medication. What are the core principles of holistic wellness for animals, and how can aromatherapy and acupuncture be integrated into their care plans? Discuss any ethical considerations involved. Answer: core principles, whole body focus, treating physical, mental, and emotional health as interconnected. Preventative care, emphasizing nutrition, exercise, and stress management to prevent illness. Natural interventions, using minimally invasive therapies whenever possible. Aromatherapy integration, essential oils such as lavender or chamomile can help reduce stress in animals. These should be diffused rather than applied directly and used in spaces with adequate ventilation. Acupuncture integration. Acupuncture can alleviate chronic pain, e.g., arthritis, and promote relaxation. Only certified veterinary practitioners should perform it, following guidelines by the International Veterinary Acupuncture Society (AVAS). Ethical considerations, ensuring treatments are evidence-based and not harmful, obtaining informed consent from the pet owner, avoiding therapies that might delay necessary medical interventions. MS. Taylor owns a 3-year-old border collie, Max, who begins barking incessantly and chewing furniture every time she leaves for work. She tried leaving him toys and treats, but the behavior persists. What steps should MS. Taylor take to manage Max's separation anxiety effectively? Answer: behavioral modification. Implement gradual desensitization. Start with short absences and gradually increase the duration. Use a pre-departure routine to help Max associate departure with positive experiences, e.g., giving a special treat before leaving. Mental stimulation. Provide puzzle toys or food dispensing toys to keep Max engaged. Schedule exercise before leaving to tire Max and reduce anxious energy. Environmental changes. Play calming music or use white noise machines. Consider a pheromone diffuser designed for dogs. Professional help: consult an animal behaviorist for customized training plans. If needed, discuss anti-anxiety medications with a veterinarian. Explain 3 effective time management strategies that animal care providers can implement in a high-demand environment. Answer: prioritization matrix. Use tools like the Eyes on How matrix to distinguish between urgent and non-urgent tasks, ensuring critical care needs are met first. Batching tasks. Group similar tasks together, e.g., feeding all animals at once, then proceeding to cleaning. This minimizes switching between tasks and improves efficiency. Delegation. Train and delegate routine tasks to team members or volunteers, allowing care providers to focus on specialized or critical responsibilities. Workplace safety guidelines by OSHA emphasize that effective time management reduces errors and minimizes caregiver fatigue. How should a care provider support an animal showing grief after the loss of a companion? Answer: consistent routine. Grieving animals benefit from familiar routines. Maintaining their feeding, walking, and playtime schedule can provide comfort and reduce anxiety. Animals rely on consistency, and sudden changes can increase stress. Social interaction. Encouraging safe interactions with other animals or humans can help fill the social void left by the deceased companion. Introduce the grieving animal to other pets slowly to allow them time to adjust and form new bonds. Mental stimulation. Providing mental engagement through new toys or activities helps redirect the animal's focus. Interactive toys or training sessions can improve the animal's mood and cognitive function, offering a sense of purpose and distraction from their grief. According to the ASPCA, it's essential to give the animal time to adjust, as grief in pets can last for weeks. Care providers should monitor the animal's behavior and seek veterinary advice if symptoms such as loss of appetite or excessive lethargy persist. It's crucial to approach grieving animals with patience and empathy. Why is networking with veterinary professionals important for animal care providers, and what are 3 key benefits it provides? Answer: networking with veterinary professionals is essential for animal care providers to enhance their skills, stay informed, and build professional relationships. Knowledge sharing. Veterinary professionals are often at the forefront of new treatments and care techniques. By networking with them, care providers gain access to updated information on animal health, which can improve care outcomes. For instance, veterinarians may share insights on emerging diseases or treatment options. Collaborative opportunities. Networking provides opportunities to collaborate on complex cases. For example, an animal care provider may consult a veterinarian for advice on managing a specific health condition, such as a rare form of arthritis. These collaborations improve the overall care approach and increase the provider's effectiveness. Career development. Networking helps animal care providers build a professional reputation and connect with potential employers or business partners. Joining associations, attending conferences, and engaging with peers in online forums can open doors for career growth, training opportunities, and certifications. What are the signs of compassion fatigue in animal care providers, and how can it be managed? Answer: signs: emotional exhaustion. A caregiver may feel drained or overwhelmed, making it difficult to care for animals with the same enthusiasm. Reduced empathy. Compassion fatigue can lead to a detachment from the animals they care for, as the caregiver may become less sensitive to the needs of the animals. Physical symptoms. Symptoms such as insomnia, headaches, and frequent illness are common, often as a result of prolonged stress and lack of self-care management. Self-care. Care providers should incorporate regular physical exercise, healthy eating, and relaxation techniques such as meditation into their routines to rejuvenate their physical and emotional well-being. Peer support. Talking to colleagues about their experiences can reduce isolation. Group discussions or support networks provide emotional relief and shared coping strategies. Professional counseling. If fatigue becomes overwhelming, seeking therapy or support through employee assistance programs can help manage emotional stress. What are the most common ergonomic risks for animal care providers, and how can they be mitigated? Answer: repetitive strain injuries. Repetitive tasks such as lifting animals or cleaning cages can lead to strains and sprains. These injuries are especially common when proper lifting techniques aren't used. Mitigation. Training on proper lifting, using assistive tools like ramps or lifts, and taking regular breaks can prevent these injuries. Poor posture. Animal care providers often bend over or squat for extended periods, which can lead to back and neck pain. Mitigation. Using ergonomic equipment, such as adjustable tables, and practicing good posture, e.g. lifting with the legs, not the back, can reduce the risk of musculoskeletal injuries. Slips and falls. Wet floors, pet accidents, and cluttered spaces increase the likelihood of slips and falls, posing serious injury risks. Mitigation. Care providers should ensure work areas are clean and dry, use non-slip mats, and organize spaces to minimize hazards. Why is continuing education critical for animal care providers, and what are two recognized programs that support professional development? Answer. Continuing education is essential for animal care providers to stay current with advances in animal health, care techniques, and industry standards. As the field evolves, ongoing education ensures providers deliver the best care and remain competitive in their careers. American Association of Veterinary State Boards (OSP). The AAVSB provides a platform for earning continuing education (see credits) through courses, conferences, and webinars. These courses are designed to deepen knowledge in specialized areas such as veterinary, anatomy, or emergency care. Fear-Free Certification Program. This program focuses on reducing stress for animals during visits or care procedures. By completing this certification, animal care providers learn techniques to create a calmer environment for pets, which enhances the overall experience for both the animal and the client. The National Association of Veterinary Technicians in America (NAVTA) highlights that continual learning helps improve the standard of care and can lead to career advancement opportunities. What psychological theories underpin effective separation anxiety treatments, and how can these theories guide behavior modification techniques? Answer. Classical conditioning. This theory involves pairing an emotionally neutral stimulus, e.g., leaving the house, with a positive one, e.g., a treat. Over time, the pet learns to associate the owner's departure with something pleasant, reducing anxiety. Operant conditioning. In this approach, calm behavior is rewarded, while anxious behavior is ignored. By reinforcing calmness and ignoring the anxious responses, animals learn to remain composed in the absence of their owners. Attachment theory. Attachment theory suggests that pets form strong bonds with their owners, and their anxiety stems from fear of separation. Gradual desensitization, e.g., short departures, can help build independence and reduce reliance on their owner for comfort. According to the American Veterinary Society of Animal Behavior (AVSAB), a combination of these theories, tailored to the animal's specific needs, is the most effective way to treat separation anxiety.